down to our last Silhouette secret confession of the day, and we've called upon board-certified dermatologist Dr. Howard Liu to help us out, and we're joined by Sue. She's agreed to show us her arm, but not her face, because Sue's a little bit embarrassed about this awkward situation.
Yes, doctors, I'm in my 50s and I'm exercising and I'm eating okay, and people think I'm younger than I am until they see my hands, which look about 70 and make me look really old. It's so embarrassing. What are these things?
Well, so these look consistent with what we call sunspots or age spots, and it's accumulation of extra pigment in the skin from just sun exposure over
Did you
years.
get a lot of unprotected sun?
I lived in the sun my whole generation.
A few spring breaks, that kind of thing?
Sun reflectors, sun lamps, always outside.
So, you know, for some of you people out there, you may have heard the expression they call these liver spots, but they have nothing to do with your liver. It's one of those terms that sort of lives on after the fact. Somebody at one point said, well, that color looks like the color of liver. They do not indicate anything other than, as Dr. Liu said, you may have overdone it in the sun at some point, and it's just part of the aging process.
Her hands look like she might be, I'm sorry to say this, around 70. But her face does not. You can't see it, but she looks great.
You look great.
I agree there with those numbers.
So we have a laser here, and if you're willing, we like to treat those for you.
Oh, please treat them.
Let's do it.
And so this would be the first of what I'm assuming would be a number of treatments, right, Dr. Liu? Or is this a one-and-done deal?
It might be a one-and-done deal. So what I'm using today is the Palomar Icon Intense Pulse Light System. It's fantastic for all sorts of things on the skin, and for the hands in particular, I've seen this kind of pigment clear in one session. So we'll see. So basically, this is going to deliver high-energy pulses, and we do the whole hand to get uniform improvement.
So this is your Icon laser, as you explained to me, broadband light, right?
That's correct. It's filtered specifically to get extra pigment in the skin.
So you're getting the reds, the browns.
That's right.
Those shades that are part of those sun changes in that skin. Now, I guess we should mention there's another condition, Travis, in older people where the purplish type lesions, purpura, which can be differentiated from these. Sue is a little bit too young to get those yet, and it's just related to fragile skin, capillary. Your blood vessels are fragile with that thin skin.
And audience, just as an FYI, we are close enough that we need to wear these protective goggles, but you all are far enough away that it's a non-issue. Are you feeling anything?
Yeah, but it's tolerable.
It's like a little rubber band?
It is.
What's going to happen is in the next 3 to 5 days, it's going to darken a little bit more, and then it's just going to fade away. And it's, I think we have a before and after of another patient that has the results done. You can see that.
So you expect to see that look now. That means that it's absorbed that energy. And do you think Sue will do well with just one treatment? Or?
I think you do well. And we can't have you walking around town with just one good-looking hand. So if you're willing to come back to my practice, I'm going to do both hands in your arms.
Oh, thank you, Dr. Liu.
Sue, thanks for sharing with us.
My pleasure.
And congrats.